Okay, so we're going to describe the functions of the skeleton system. So you're going to notice in each system, you're going to describe the function. Then we're going to describe and differentiate between the axial and the appendicular skeletal. Number 4, we're going to do the function and structures of the joints. So that where it could be a little confusing, the structure of the joints. And the last thing is we're going to describe the 5 types of movable joints. Correct? Okay. Now there's a lot of more info in there. But we're going to start with these first and do some questions and see how it goes. Sounds good? And if we need to dive into more detail, we can definitely do that. Okay, so the skeletal system is the bony framework of the body and composed of these 3 things, not just bone, it's bone, ligaments, and cartilage. So that's part of the ligament and cartilage is part of the skeletal system and not the muscular system. First, it offers a framework for support for the body for the structure and it holds shape because muscles with no bone is just a mess. Second, the bone protect and the internal organs and tissue. It also provides attachment sites for the muscles so they can function and act as a lever in conjunction with the muscle to produce movement. So muscle and bone together create movement. They also manufacture blood cells in the bone marrow, and we store minerals in the bones such as calcium, potassium, and other minerals like magnesium and sodium. Nice and easy. Now, composition of the bone. There's dense hard tissue that forms the body of the tooth. For example, bone is the hardest structure of the body. Now, there's two matter, organic and inorganic. The organic matter consists of the osteocells. So osteo is bone and cytes are cells. So the organic matter, which is the animal matter, consists of osteocells, blood cells, and connective tissue in the bone marrow. Here we go. And the inorganic consists of the minerals, which is calcium and potassium. Done. That's it. Nice and simple. Now we have bone forms and shapes. I don't know if I'm covering this, but when we talk about bone shapes, there's the long bones like the tarsals, phalanges, the forearm, the radius, the ulna, the humerus, femur, tibia, fibula. All these are long bones. Flat bone is going to be like the one we find in our skull. Short bones, as you see here, are tarsals, which in the foot, and carpals in the hands. And in the spine is irregular. It's a regular shape. And here's our examples of other flat bone, pelvics, ribs, and other examples of the long bone and irregular bone. And we have sesamoid bone, which is patella in the knee. All right, next we're going to characterize the bone, like the anatomy of the bone. We have, let's say it's a femur. We have the ends of the bone, which are called epiphysis. And the shaft or the long section is the diaphysis. Inside the cavity, inside the bone, there's the cavity where we find the spongy bone or the soft bone, where the covering it's going to be the hard bone or compact bone. So compact bone is going to be the periosteum, which is the outer covering, where the inner part where you find the bone marrow is going to be the softer, what do you call it? The softer bone. Now,
so the compact bone is the same as the periosteum?
Yes, it is the periosteum. It is the compact bone. And what's inside is the spongy bone is going to be Where's the word? It's going to come to me in a second. So as far as the outer layer, it is the hard bone. Oh, the spongy, sorry. It's called spongy bone. At the ends of the epiphysis, we're going to find the red bone marrow. And the sponge bone, which is the marrow, is in the middle. And in the cavity, you're going to find the blood supply and the arteries running through. And that's how the bone gets its blood supply. So what can you get from this? You want to get the name of the ends of the bone, which is the epiphysis, and the center or the shaft is the diaphysis. These two important things. We know that the outer layer covering, it's the periosteum. We're going to know that the red bone marrow are concentrated in the ends of the bones. And you can, and these are really important here. So the compact bone forms the harder outshell found in the shaft that that can how do they do that? Cancellous bone, which is located inside the bone marrow flat bone, but don't worry about that. Medullary cavity is important. It's the hollow chamber formed in the shaft of the bone and that filled with yellow bone marrow. Okay. And marrow is connective tissue filled in with the cavity that forms red and white blood cells. So we find the red and white blood cells in the marrow, in the center, or in the cavity of the bone. Now, let's talk about the two types of skeleton we talked about, which is axial and appendicular. So the skeleton is broken into two sections. The axial is made of the bones of the head, the skull, the spinal column, all the vertebrae all the way to the coccyx, and the ribs. That's it. That is the axial. Like an axis. That's the axis of the spine. The appendicular, on the other hand, it's made of the bones of the shoulder, extremities, hip, and lower extremities. Let me see if there's another picture of that. Right here. So appendicular skeleton is going to be scapula, clavicle, humerus, and the forearm and the hand that hold these bones, and pelvis, femur, and the lower leg as well. So technically the hands and feet, hips, and scapula. Sorry about that, stuck a little bit. Okay. Just for the sake of being able not to overwhelm you, it can highlight the bones here. So in the axial, we got the cranium, which is the head. It has 8 bones. And these are the names of the 8 bones. Were you with us in the class when we discussed all these bones?
I was, yes.
Okay, great. So we got the cranium and we got the face, consists of 14 bones. We got the ear, the hyoid bone at the support base of the tongue, vertebral column, which is 26 bones. And so it's breaking it down here for you. And the thoracic cage, rib cage, which is 25. For example, the costal ribs, 24, 12 on each side. And you got the sternum one. So that's how you 25. Okay. Now with the appendicular skeleton, which we talked about, that's the shoulders and the hips, arms and legs, in other words. So the upper extremities, clavicle, scapula, humerus, and all these bones. And the lower includes the pelvis. And the pelvis is infused, yes? Infused just like the skull. The skull is infused sutures. The pelvis is infused in 3 parts of it. There's the upper part, the front part, and the part that we sit on. So the ischium or ischium is the sit bones. The pubis symphysis is in the front, and the ilium is the sides, upper hips. Okay, we went through all the bony landmarks last time. So we'll practice those as we come more into doing the kinesiology, just like we did with the forearm and hand. Okay, so you got the cranium, you got the occipital, parietal, frontal, the sphenoid, and the temporal, and all the tons of the front bone of the face. But the major one We got the mandible, the maxilla, the where is that? Well, the orbitals, sure, the supraorbitals and the infraorbitals, the nose, bone, ethmoid, lacrimal. These are a little deeper in the eye socket. So, anyways, that's a whole nother subject to get deep into this. I just want to make sure that you understand the function and that you understand the difference between the axial and the pendicular, and that we go into the joints. Okay, remember we have three types of joints. Synothyrotic means it's immovable, right? Amphithyrotic, partially movable, and diathyrotic, which is most of the synovial joints in the body, the movable joints. And in the workbook, they give you empty space and you can fill that in, and that helps you memorize them. But if we keep it simple, it's much easier to have stick in our memory. Alrighty, let's minimize this. Is this better when I minimize it like this?
Mhm.
Cool. Alrighty, so the classification of synothyrosis or immovable joints. So synothyrosis, immovable joints, you're gonna find them in the sutures. So they're fibrous, made of fibrous connective tissue. And that is the sutures of the head. They are synothyrosis, they do not move. Let's go to the second type, which is the amphithyrosis, which is partially movable and it made of fibrocartilage. Yeah, so fibrocartilage, and these are fibrous tissue. That means these are harder. These are harder. These are in the middle. So the discs of the spine. And the third type, which we're going to discuss the 5 types of joints, are going to be in this category, which is the diathyrosis joints. They are movable, and there's 5 types of them. Okay. So the sutures are in the head. They're immovable. And these are in the teeth. Let's discuss the movable joints, the 5. 1, 2, 3, 4, 5. Kind of they gave us another 1, 6. So the pivot is freely movable synovial joints, and the pivot, we can find that in C1, C2. The hinge, we find that in the elbow and the knee, and here's where you can find them. Okay, this is an example of where you can find them. Ball and socket in the shoulders and in the hips, they kind of go all the way around. Gliding, they're going to be the spinal process of the spine between the vertebrae. And you can find them in the wrists and the ankles. Saddle, you find that in the thumb because saddle can move 2 ways, can move in 2 planes of motion. And condyloid or ellipsoid, same name. You can find that in the radius and the carpal joint in the wrist. So it kind of glides like this, yeah? This way, that way, but not like the hip or the shoulder. Alrighty, we got cartilage and ligaments. So cartilage is pretty firm, tough, elastic substance. Similar to bone, but not as hard as the bone, okay? The purpose of the cartilage is to cushion the bone. So you find it in all the joints. Think of it as like let's say you get a stick, or let's say I have this water bottle and I'm gonna get a Play-Doh and put it here and play with it. So we kind of create like a blanket with it on top of the bottle. It's the same thing. That's how cartilage is on the joints. It lays on it like that. It prevents jarring between the joints and in motion. And it also shapes the external features of the nose and ears. This movable cartilage right here.
Mm.
Okay, now the cartilage itself has 3 types. Hyaline, fibrocartilage, and elastic. The one is fibrous, one is a little elastic, and one is hyaline, which is most common, and that where you find in the joints. Articular cartilage, meaning joint cartilage, in other words, and it caps the articular surface of the bone of the synovial joints, just like I talked about in the bottom. The fibrocartilage is much more denser, okay, and you can find that in the pubic symphysis and in the discs. And the elastic cartilage, which is most flexible from all these, you can find in the ears. Good?
Mhm.
I know it's a
Good.
lot of words, but it's simpler in the book. Okay, now next is going to be ligaments. So ligaments are bands and they connect what to what?
Bone to bone.
Right. And when we have injury to ligaments, what would that injury be called? A sprain or a strain?
Sprain. Sprain with a P. Sprain.
Correct. Exactly. So you know those little think of it as there are if you have like two pieces that you want to like two pieces of paper you want to combine together, you get a piece of scotch tape and you connect those two. That's how the ligaments kind of work.
Hmm.
Now, bursa are fibrous sacs lined with fluid and they lubricate the joint. And its function is to cushion the area to reduce friction. Um, Injury to the bursa can cause inflammation and swelling, and that would be called bursitis. And we know what synovial fluid is. Every synovial joint has synovial fluid running into it to lubricate it. And it has a membrane to house the fluid. Cool? Now, let's dive into the types of movable joints, which is synovial joints, which we call them diaphoretic joints. We have pivot, has an extension of one end on rotation in relation to the other bone, just like the one in the neck. The talus and the axis is C1 and C2. Also between the radius on the ulna, just distal to the elbow. So as we rotate our wrist like that, that is pivoting. That is pivoting, okay? Hinge, right? We talked about hinge, elbow and knee, ball and socket, which has the most greater range of motion, right, is the hip and the knee. Then we got the gliding, as I mentioned before, and you can find that in the carpals, metacarpals, and in the spine. And the saddle, which we find in the thumb. The thumb is pretty unique. Condyle or ellipsoid is the same thing, and they're oval-shaped end, and they articulate with an ellipsoid basin. So let me show you right here. So hinge, so technically they can't go anywhere but extension and flexion. And that would be uniaxial. It's on one axis. The ball and socket, for example, is multi-axial. So it can go in more than just like the spine. The spine is two things, is multi-axial and it glides as well. But the hip socket is multi-axial, is more than one axis. You know, we have the sagittal plane, transverse plane, you know, we have more than planes, so it can go in more than one plane of motion. Condyle or ellipsoid, okay, it can go in, and same with the saddle with the thumb, they can go in more than one axis, two axes. These are all the bony landmarks for the muscle attachments that we talked about. As we continue with kinesiology, like we did with the other classes covering the muscles, the attachments, we're going to learn all these names. As you also create your flashcards or look at the muscles attachments, you're going to come through these and understand them some more, but I'll just go over them briefly. So condyle is round. Round. You're going to find those condyles in the ends of the femur. Crest, like the ridge of the hip. Foramen, we said it's a hole. We find that in the discs and in the pelvis. Anything with a round bone and there's a hole in it. Fossa, anything with a depression, like the scapula has a depression, flat surface with a depression in it. Same thing with the pelvis, where we have the iliacus. It sits on the depression of the hips. It's like a bowl, but kind of not too deep. The head is round articulated process at the end of the bone, so it's could be flat, doesn't matter, but it's at the end of the bone. A line, it's like a ridge. Meatus, you can find a tube-like passage. We find that in the nasal passages. Process is only, it's also a prominent or projection, so it sticks out like a ball. The sinus also we find in nasal passages, a spine like the spine of the scapula, a sharp, slender projection. Trochanter, that's what we find in the hip, so it's pretty large process. Many muscles attached there. Tubercle is a small round process, and a tuberosity is large. So the tubercle could be as little as, like lentil maybe size, and a tubercle could be like a peanut size. Okay, pathologies of the spine, of the skeletal system are super straightforward. You got fractures, so as an injury, if the bone gets a hairline fracture, a fracture all the way through the bone, but it's stacked up correctly still intact in shape, but the break is through the bone throughout the whole bone. Complete or open or compound, there's a complete separation between the ends of the bone and comminuted is going to be more like crushing the bone in many different pieces. Dislocation is when the joint comes out of its socket. So there's going to be a lot of trauma to the ligaments in this case. A herniated disc is going to be a weakness into intravertebral discs that result in a protrusion. So let's do that. And we talked about the three classification of injury to the ligaments, which will be a sprain, class 1, class 2, and class 3. So class 1 is a stretch. There's a little loss of function, little discomfort, but it's bearable. At class 2, there's about 50% tear, and that ligament will be torn for some loss of function, dislocation from the tissue. Might be bleeding present. Class 3, you're technically loss of function, a severe loss of function. You pretty much tore the whole ligament, between 50 to 100% of damage to the ligament. And all these sprains will be experiencing swelling, right? And swelling, comes with swelling or injury is inflammation. And inflammation will include pain, heat, redness, and swelling. And as it says here, loss of function, loss of function, loss of function, okay? And this you're gonna find in all injuries that accompany inflammation or, strain or a sprain, or it's gonna be inflammation. These 4 are very important to know. Next, we got arthritis, which is inflammation of the joint. And there's many kinds. There's rheumatoid, okay, autoimmune, osteo to the bone, or gout buildup of acid in the big toe. So rheumatoid arthritis can be chronic, systemic, or autoimmune, constant to the whole body or to the immune system itself. And the disease is the most serious and crippling of all. Is a systemic disease often involved in several joints. So systemic means that the whole body, where gout could be in the big toe. And it affects the synovial membrane that lines up the joint. The joint become, again, the signs of inflammation that you're going to see. And the treatment Massage is contraindicated in the acute phase, meaning if it's in, sometimes it could be in remission where it could be not so bad, but sometimes it can exacerbate and it can flare up. And that would be acute, and we don't touch it because massage will make things worse. We're going to make more blood flow, we're going to create more heat, and we don't want to do that. But in remission stages, gentle massage, okay, for the joints can bring blood flow and might help in range of motion and all that stuff. Because we said nutrition is in the blood and in the lymph, correct? Okay.
So if so, what could we tell somebody with rheumatoid arthritis to do if they have a flare up and we don't massage it? Do they ice it? What should they do?
Well, they have to take anti-inflammatory sometimes medications. Sometimes ice will help, but sometimes some people cannot handle ice because it's going to make the joint more stiff,
Hmm.
right?
So
So
just
you got
wait
to
it
see
out.
what they can tolerate. So you kind of
Yeah.
work with them on that. Okay,
They
does that
usually are on some
handle?
sort of immunologic like medication if you have rheumatoid arthritis. So
Yeah, sometimes, yeah, they give some medications to help, but again, mo gentle movement is always the best. Something the body can tolerate and not being so rough. And you can't also ignore it because joints need to move, otherwise they calcify.
Moving. Just
You
the
have
gentle
to,
movement.
very
Okay.
gentle, super gentle. There's osteo massage you can learn that you can massage the bone and not be gentle, not squeezing too much. It's just got to be gentle. And the best way is to communicate. How is this
Okay.
pressure, more or less? Osteoarthritis, which is chronic. Osteo means of the bone and accompanies aging. So it doesn't have to be really any specific reason. Sometimes just aging process can affect it. And it affects the synovial joints, right? And from wear and tear and trauma. Wear, tear, and trauma. So the knees, hips, and spine are more common sites for this degenerative disease. Okay, it can come and go and range in mild or intolerable. So the pain can be, varies. And in acute inflammatory stage, the affected joint can be swollen, again, hot, heat, and painful. In a subacute, okay, the pain in the joint subsides, and that's when we can work with people when they're in the subacute stage. There's no cure for arthritis, that's what they say, but if you eat the right foods and take care of yourself, you might be able to at least not have it progress so fast. Again, medication, exercise, massage can help to relieve pain and maintain mobility. Mobility is the most important thing. Okay, spondylosis is another degenerative arthritis condition that affects the vertebrae, the lumbar region as well, and it's degenerative as well of the intravertebral disc and forms bony growth. And that's the problem because sometimes it can narrow the canal for the spinal cord and it can sometimes do a compression on the nerve. So it could be super painful, which is called bone spurs. And to take care of these, sometimes surgery is needed. And it slowly progresses and affects middle to elderly people. Gentle exercise, super important. It's gentle and repetitive is best instead of intense and inconsistent. So these people need to move a few times a day and definitely daily, but on a low intensity. Massage may be appropriate with the caution of cooperating with a provider, with their doctor. Okay, now the acute gout arthritis, it's also called gout and it's caused by high concentration of uric acid. So eating meat is terrible for these people, terrible. And yeah, that's pretty much for this one. Okay, ankylosing spondylosis is a type of inflammatory arthritis that targets what? Yes, sacroiliac joint. Sometimes when you hurt the sacroiliac joint, it's very hard for it to heal because it made our fibrous connective tissue and the spinal articulation, including the ribs as well. The shoulders, the hips, and the small joints of the hands and feet. So it can be everywhere. Unfortunate. So it's a genetic autoimmune disease that primarily affects men between this age and that age. Now, the chronic Spondylosis begins with stiffness and pain on the lower back hips and generate back to the neck. In severe cases, it leads to spinal fusion. That's the problem because it can build bone spurs and the vertebrae can kind of stick together. So you get a lot of stiffness in the back. And again, sometimes they might require surgery to open the canal or to free up some space in there. Bursitis, we mentioned that earlier. And again, excuse me, I forgot to talk about the contraindication for massage. So all inflammatory conditions, massage is contraindicated during the acute phases. So when the person is not in pain or like it's in remission or in their best, states, that's when we help them with massage. Very gentle stretching because we want to allow the nerves to relax and stretch. If we do excessive stretch, we might trigger the nervous system. We do not want to do that. So you have to be super careful and gentle and be in tune. Bursitis is the sac that helps cushion the joints, and inflammation of that sac will be called bursitis. Again, massage is locally contraindicated, meaning just for that area during the acute stages. Okay, however, in a subacute, mild exercise, range of motion, massage are acceptable. So you're seeing a pattern here when it comes to skeletal system. You got to know there's an acute and there's a chronic phase, and you got to combine therapies with lifestyle for them to be better. But massage, a definite help for them. Okay, osteoporosis. So increase porosity of the bone. So the bone becomes less dense, becomes lighter, and then becomes more porous, which affects more women than men. And also natural aging as well. Bodybuilders have dense. So if you're lifting when you were younger, you probably have stronger bones and minerals. And they will fracture really easy as they get older. So it's pretty dangerous as you get older because if you fall and break your hip, it breaks very, very easily. Okay, spinal curvature. We got 3 types of spinal curvature. We got scoliosis, lordosis, and kyphosis. These are different curvatures in different planes of motion. So if we look at laterally, first, if we look and we see an S shape going in we'd call it like a lateral, right? You won't be able to see it if you're in the lateral position as much as if you are in the posterior, looking at it from the back. You'll be able to see the S curve. That would be scoliosis. Correct. And excessive lower will be lordosis from lumbar. And kyphosis will be around the ribcage area.
Oh, is that when someone has a bump, like a hunchback?
Yeah, can be. If it's excessive, it'll be a hunchback. All of these can be strained. You got to do a lot of stretching, a lot of restorative movements to help them. Okay, we got a long list of questions right here for this. We're gonna go as far as we can with the questions. And we go from there. You ready for the questions?
Mm-hmm. Ready.
Awesome. Which structure make up the skeletal system? So when we talk about like the skin, we said the skin consists of nails, hair, blah, blah, blah. Now, what about the skeletal system?
Bone, ligament, and
One more.
Tendons? No.
fascia?
With a C.
Cartilage.
Cartilage.
Correct, Mundo. Awesome. Number 2, name functions of the bones.
Produce blood cells.
Yeah, white and red blood cells, correct.
For structure.
For structure, correct. 3. it houses the organs, right? So it does what?
Protects.
It protects. And where do muscles attach to?
And
The bone.
bones.
So yeah, so it's attachment site to the bone. And you already said the red and red and white blood cells. And then the last one, it stores what in there?
Minerals.
Correct. Like calcium phosphate, calcium carbonate, magnesium, and sodium. Okay, what do we have left here? Number 4, name 2 types of bone tissue and indicate where they are found. I'm going to give you that.
Name the organic.
Inorganic is
Yes,
the
exactly. Organic and organic. So the organic would be what?
the
Fibroblasts.
Osteocells, right? Which is the bone cells. And
what? The blood?
blood, correct?
Mhm.
And what's inside the bone?
Marrow?
Correct? And connective tissue, correct? Now, the inorganic is just
The minerals.
minerals, okay? The calcium phosphate, carbonate, those kind of stuff. Number 4, name 2 types of bone and indicate where they are found. So when we talked about the structure of the bone or anatomy of the bone, we have an outer layer that tends to be kind of harder, and the
Mhm.
inner layer, correct? That tends to be more
Spongy?
spongy. Exactly. So 2 types. We got the cancellous, which is spongy, in other words, tissue, and we have the dense or compact. You are correct. Okay, number 5. Which covering protects the bone? What's the name of it?
Per
Mm-hmm.
peri Estrium?
Yeah.
Ostrium.
Mm-hmm.
Periostrium.
Mm-hmm. Okay, awesome. Number 6. How are the bone nourished?
Through the marrow?
Sure, the marrow, yes. The bone marrow aids in the nutrition of the bone. And what else? There's a supply of something that supplies the whole body with nutrition. Would be called
Blood.
blood vessels. Yeah, the blood vessels enter the periosteum into the inner of the bone, and that nourishes it, and the bone marrow. Correct. Okay, name the various types of bones found in the body.
Long bone?
Give me one example of a long bone.
The femur?
Sure. Great.
Phalang-
Sorry.
Phalanges.
Phalange. Great. And what's the next type? Next
Short.
shape.
The short bone?
The
Wrong.
cervical,
Cervical or what kind of shape? The spine.
the spine, the
Irregular?
Ellipsoid.
Irregular. Irregular. Ellipsoid is a type of joint. But when we talk about bone shape, we have bone shape different in different parts of the body, right? So we
Flat bone.
said long, flat, like what?
The
You got it.
scalp or whatever.
Yeah, the skull, like the skull, it's flat bone. And you said long bone, like the femur, like all the other bones, like the phalanges. And then we have
Short bone.
short,
The ribs bones.
like the carpals. So the ellipsoid and all of these are types of joints. Here we're gonna talking about the shapes, what kind of shapes of bones we have. So the spine is all like sticking out, poking out, irregular. The head is flat. The arm, the foot, the leg, lower leg, and the fingers are long. Short are we said here in the tarsals and the carpals. And what else?
There was a,
Did we get them all?
no, there was one, other one. That was
I think.
the sesamoid.
Sure. That's for the where you find that.
The patella?
Correct. Awesome. That's great.
Okay.
Okay. Did I lose my question or what type of Okay, number 8. Name two kinds of marrow that were each is found and where they are found. So there's two colors,
Red and yellow.
correct. Where you find the red.
Red's more at the top,
Mm-hmm.
and
And
is the yellow in the middle of
in the shaft, right. So in the diaphysis and the epiphysis is where you find the red bone marrow, which is the ends of the bone, and the yellow is in the center. Correct. Okay. Name what is the function of the red bone marrow? What do they produce? What do they synthesize?
the red blood cells.
Correct. What are the two main parts of the skeleton? Right? The skeleton is broken
Not
into
act-
two.
Axial and appendicular.
Correct. 11. Name three classification of joints and differentiate between them. So when it comes to movement,
Or saddle.
no,
Oh,
not
like
types of
synovial
synovial joints, types of joints when it comes to movement.
movement. So
So I'll tell you movement and you give me the name. Immovable, partially movable, freely movable. One starts with an S, one with an A, one with a D.
synovial is immovable,
The
right?
novium is movable. And what's another name for movable?
Oh, with there's like a diar.
Yes,
on
diathoracosis,
Arthritic.
yeah, or diathoratic. Cool, that is the synovial type of joints, correct. Now, the partially movable, like
There's
Cartilaginous?
that's what they could be made of. But first, this classification first according to movement.
like a
Yes,
cinerotheroid.
yes. Synathoratic is the partially movable or immovable.
Not movable.
Where we find those?
The
Oh,
the skull, yes.
Sutures. Sutures of the skull, correct. And now what do we call the partially movable?
Amphithyrosis.
Yes, amphithyrosis or amphithyrotic, correct. Awesome. You find that in the spine and in the
Pubic synthesis.
awesome. Number 12, which structure cushions the bones at the joints?
cartilage.
Yes,
Um,
cartilage, articulating cartilage. So that's the one is like cap, it's like the cap on the head or the ends of the bones, okay? They kind of stick and stay there. They don't move. They just kind of cushion. It's like when we wear socks in our feet, cartilage is the sock for the bone
Hmm.
at the articulating end, okay? Number 13. Which structure connects and supports the bones at the joint? Meaning bone to bone is connected by what?
Tendon. Wait, bone.
Now, tendon connects the bone to the
Muscle.
correct. Now we're talking about connection at the joints where the joint is one bone. Joint makes two bones together. I know. I know. It's because there's so many information. It's just like and the question, the way they ask it, they don't help you. So let's read it again. Which structure connects and supports the joint? What makes a joint?
At the joints.
What makes a joint is two bones coming together, right? So the cartilage is there for cushioning as we kind of articulate it. Now, what makes it stay together and not fall apart?
Oh,
What connects the bones together so they don't fall apart? Makes the
Tendon.
connection. Tendon is, as we said just now, bone with muscle. And bone to
ligament.
bone is ligament.
Ligament.
Yes.
Yeah.
Yeah.
There's so many, like, geez, couldn't they just use the same material?
I know. And this is why sometimes it's hard, like the way they're asking things. Sometimes like, what are you talking about? Okay. That's why I like to do the A, B, and P questions because I want to do things the way they ask them on the exam. Which fluid lubricates the joint?
Synovial.
Yes, synovial joints. Another a synovial fluid. Another name for it is synovium, in case they kind of trick you a little bit. 15. Approximately how many bones are found in the human body?
206.
Correct.
Oh,
$500. Okay. Why must the skeletal system be considered in the practice of massage therapy? Why
Identifying
should you? I know, it's like that's a weird question. Why must the skeletal system be considered in the practice of massage therapy? In other words, why should you, as a massage therapist, have the
for
knowledge
attachment
about, yes, okay,
or
yeah, exactly, for attachment.
identifying uh fascia. I don't know.
the joints and stuff. Knowing where the joints are.
Yeah, joints. So what do we do with joints? We kind of do
I
what
mean,
we
I
do
want to rate
with
just
joints.
because it's part of the body, but
Yeah, but you're gonna manipulate the joints, right? As a massage therapist, so you're gonna move them around. You're gonna move the joints. You're gonna move the bones. So you probably want to know, like maybe the range of motion of the bone, right?
Okay.
And yeah, because you're gonna manipulate it and know it. You kind of know, like, okay, this bone will articulate this much. This bone will, just to know how to move the body and how to go about it. Don't worry about that. That's just a philosophical question. Okay, number 17. List 5 types of movable joints and give an example each. Now these are the 5 names we talked about.
You have the ball and socket, like those,
Yes,
right?
yes.
Okay. So that's your
ellipsoid,
shoulder and your hip.
So what do we call the shoulder joints since you said shoulder?
body, ball and socket,
Ball
right?
and socket. Okay, what other type? So here's one.
Hinge joint,
Which one?
hinge,
Hinge. Where do we find the hinge?
the elbow and the knee.
Correct.
And
Um,
then the
thumb,
saddle.
Saddle. Where do we find that?
Is that the thumb?
Yes.
Okay.
Correct. Here's 3.
ellipsoid,
Ellipsoid.
the wrist.
The wrist right at the radius and the carpal meeting together. Right
Mm.
here, sorry. Radius and carpal meeting together. They create the wrist joint. Yes.
Is there another one?
I think there's 2 more.
Mm-hmm.
The neck.
One more.
Yes. What's the motion of this?
Um, the
Starts with a P. Start with a P.
Um,
Okay.
the
So when the
wait
head
with
moves this way and that way, what do you call that movement?
pivot.
oh yeah.
Good
Pivot.
job. I'm proud of you. Alrighty. 18. What is a fracture?
A, a break.
R18. Oh, R18 is
Did
different.
I miss something? What is your 18?
No, it's just in a different order. That's fine. All right, your 18 is R21.
Oh,
That's
sorry.
fine.
Okay, yeah, 21. Let's do 21. That's fine. Because let's go with
We'll
that's
go with
fine.
your, okay, what is a fracture? Is a break in a bone.
Yes, break or rupture in a bone. Good. Okay, so is 19 the same like you have in the book?
19.
What is the
What? No,
sprain?
that's number 22.
Okay, let's go to number 22. What is the sprain? Describe the difference between the 3 classification of sprain. So first, sprain is what? What is happening? Who's getting injured?
A
Or what is getting
ligament,
injured?
ligament to
Ligament. And what's happening to the ligament?
it's tearing.
Yeah,
Or
tearing or stretching. Awesome. Awesome.
stretching.
And
Okay.
how many classifications there is?
There's three. The
Okay.
first, the
Mm-hmm.
first one is very minor with
Mm-hmm.
maybe a little bit of pain,
Sure.
right?
Correct.
And the and and then the second one is a greater tear, I guess,
So there's a
or
there's a tear. There is a tear.
okay.
And what about loss of function? Complete loss of function
There's
or
some loss of function for two.
yeah, some, only some, but still
And
kind
then
of.
for three, it's loss of function and a lot of pain
Mhm.
and if like 51 to 100% tear, I think.
Correct. Correct.
Yeah.
Correct. Correct. Okay.
Okay.
Thank you. Number 20. What is arthritis? And what are the three most common types?
So
So when we say
inflammation of your joints.
inflammation of the joint, arthro means joint, and itis is inflammation of the joints. Okay. So we have all these joints that we talked about in the body, and let's talk about mention if you can mention three of those.
We have osteoarthritis, which comes from
Mhm.
age.
Yeah, or you can just mention the name. It's fine.
Oh,
Osteo.
and then
Perfect.
rheumatoid
Great.
and
The one with the acid
oh, the
um,
gout.
gout. Okay, these are enough. So osteo, rheumatoid, and gout arthritis. Very good. Where are we now? What is osteoporosis? Now you can emphasize on that. And which precaution must be observed when massaging a person with osteoporosis?
So osteoporosis is when your bones become more porous.
Middle,
Yes,
right? Yeah.
yes. And it lacks minerals, it loses minerals, and it becomes porous and more and weak, right? Brittle, all these things. So what is it
Yeah.
you need to be careful of when you're working with these people?
Maybe elasticity, like
As far as your work as a therapist, as far as
Maybe
your
like
hands and your application.
pressure, maybe not too
Yeah,
much.
pressure. You need to be aware of pressure. And what
speed,
else?
flexibility, rotation.
Yeah, range of motion movements, right? So not doing forceful movements to the joints as when we stretch them. So we can't really stretch them forcefully. We have to be super careful with how we go around articulating their joints and how much also pressure we put on the bone. Correct. Okay, so that leaves us with what? Describe three abnormal curvatures of the spine.
Lordosis,
And that is where,
lumbar.
correct?
The scoliosis is like an S shape.
Lateral kind of curvature. Okay, correct.
And then the
Oh, how far?
kyphus,
Yes.
and that's in the cervical spine or hunchback.
Yeah, not cervical. Cervical is the next, more on the thoracic,
Oh, okay.
where behind the lungs, right?
So the
Correct.
Quasimodo then.
That's perfect. Awesome. Alrighty, we're good. Um, do you want to do, I know it's what time is it now?
120. 190.
1:20. So do you want to do 10 minutes of ABMP and then do the massage? Yes. I like when you say yes.
hmm I might leave right after this though.
Okay, that's perfect. And then you can do the video whenever you want to follow the
Okay.
massage stuff, okay?
Got
So
it.
I'll record it on a separate video, and when you have a body and want to practice, you can play it. Now, on Monday, we can open up with pathology questions, but today we're just going to keep it on the anatomy, okay? Alrighty, how many bones are in the appendicular skeleton? Feel free to open the book and find that number.
How many bones are in?
The appendicular skeleton. So if we go here, and we go to the appendicular skeleton, we're going to see the list of the bones broken down.
126.
Okay, let me
Yes,
go back to that.
yes, 26.
Awesome. Okay, symphysis joint or
Chondrosis.
synochondrosis joints.
Chondrosis. These are Italian.
Yeah. Are types of what? Hinge, synovial, diathoracic, or amphithoracic joints. So if you don't know this word, you will know this one. The
Seems
symphysis.
like it's synovial fluid, so I would say diarthrotic, but what do you guys think?
The symphysis,
I'll,
where we can find a symphysis. Pubic symphysis. Remember pubic symphysis?
Oh, that's partially then. So amphi, it's D.
D is
D? Correct.
correct.
Name the 5 long bones that make up the distal part of the longitudinal arch of the foot.
The
Metatarsals.
So
Or the
when we are the
yes.
arch, which bones are in the arch?
metatar
The,
the metatarsals?
Okay.
the, the, the
One,
torso,
uh, try this question. One of the functions of the bone is to serve as what to the internal organs? Support, storage, producer, or protection? So what's the relationship between the function of the bone and the internal organs?
Protection.
Action.
The
Every
trans
answer's been D.
You said protection, correct?
Yeah,
Yes.
every answer's been D though so far.
Oh, I didn't even notice.
Hmm.
The transverse foramen is an opening in the transverse processes of which vertebrae? Sacral, lumbar, cervical, or thoracic. We did not go through that today. Anatomy of the what do you call that? Of the vertebrae, but
Transverse. I think it's like where your transverse muscles are. So
oh
it's
no, this has to do with the anatomy of the vertebrae itself. So transverse foramen is
Think
an opening in the so the vertebrae, you have a spinous process. Spinous process are the line you see, like the bone sticking out in the middle of your back. These are spinous processes. Now there's ones on the side. These are called transverse processes. So is an opening on which vertebrae? So some
sacral.
vertebrae have that transverse foramen in it.
It's sacral.
Hmm?
Sacral?
Let's just for the sake of time, let's just pick something,
Uh,
and then I'll go over it with you. You can also look at the anta. If you go thoracic and spine, you look up bones, and you can find the vertebrae. Uh, you're close.
lumbar.
yeah.
Oh,
Oh,
I figured it was the closest.
We just go down the list.
Well, if it's, I would say thoracic. Oh my gosh.
cervical.
We'll go actually through the anatomy of this on the I'll go over it again in the nervous system because we're going to talk about the spinal nerves that stem out of there. For now, don't worry about that too much.
Okay.
But keep a note on it, okay? Okay, name a small prominence or bony landmark on the upper anterior portion of the humerus that serves as an attachment site for the subscapularis. So subscapularis is muscle, where we find that muscle, if you remember. If you don't, I'll tell you.
Under the
Yeah, it has to do with the scapula. It's one of the rotator cuff muscles. But remember when we said sub? So we can scularis or scapular, and then scapula. Sub, it's somewhat underneath.
underneath, yeah.
So that's on the anterior side of the scapula.
It's
So the
more
posterior side of the scapula is going to be like right here. You can touch it. You cannot touch the anterior side of the scapula unless you really dig in deep within your armpit right here to find the subscapularis. Okay.
and
Now,
a tubercle is smaller than a tuberosity, so
yes,
it would probably be
yes,
tubercle.
the tubercle is smaller than a tuberosity.
So maybe D?
So deltoid tuberosity is here, so it's not going to be that for sure. Which one, D?
Yeah.
So in the humerus, there's 2 bony landmarks. There's a lesser and there's a greater. So it comes from here and attaches. We'll go through the anatomy. We haven't been to the anatomy of the shoulder yet, so but you already know more than you think about it. Which joint do the glenoid cavity of the scapula and the head of the humerus form? So when we said two joints come together, they create a joint, right? And we said the combination of the names of the two joints create the name of the joint.
So B,
Which one?
B,
B as in boy?
yes.
Correct. Name the large distal end of the fibula that projects over the lateral talus. So fibula is going to be in the upper leg or lower leg?
Lower.
Lower leg, right? So the
Mhm.
fibula and the talus. So we looked yesterday at the talus, right? We looked at the calcaneus, the heel, and the bone on top of it, the talus, and then the tarsus,
Lateral
right?
medial.
So remember that?
Mhm.
Okay, now fibula is lower leg. Is it medial or lateral?
Lateral.
Medial.
The fibula, it's lateral, correct. So the projection at the end, which one would it be?
I would say
Oh,
malleolus, right?
Yeah, correct. Lateral malleolus. That little bones on the outside of like these bones,
Yeah.
but on the ankle.
Um,
Correct. Ribs 11, 12 with no connection to the sternum are referred to as
floating
Ribs
rib.
and ribs, right? Both.
floating ribs.
Isn't it a false rib too?
Um,
There is something called a false rib, right?
yes, there is, but let me see if it refers to the 11. No, the 11 and 12 are floating ribs.
I think it's below the
Oh, it's the last one, right?
The
are the
last
false ribs,
one, yeah, go ahead.
are they the like the cartilage looking stuff that's like
Oh, in
at
the beginning. Yeah,
the
I know.
front of the rib,
Yes, but let me double check.
maybe?
Yeah, it is. So because they're kind of connected all together, just let me give you the numbers. So the three pairs of ribs that are 8, 9, and 10, which attach the spine in the back and connect to the cartilage at the ribs, and they are referred to as false ribs. I think it's the same thing. Oh, no, floating ribs are the last two, 11 and 12, and the false ribs are 8, 9, and 10. Yeah. No, we're good. I just kind of forgot for a sec. But you understand? You got it, right? The coastal ribs are the one that attaches, the top ones attached directly to the sternum. There's no such thing as a true rib unless, it's one way to talk about it. Okay, the closed sac formed by the joint capsule, which contains the synovial fluid, is called, so it's a sac.
Wait. Oh.
So a closed sac formed by the joint capsule, which contains the synovial, houses the synovial fluid, is called what? Osteomarrow, articular sac, joint fulcrum, or joint cavity?
Well, the only one that says sac is articular, right?
Oh,
I'm thinking it's D, joint cavity, which was my first answer technically.
Oh, we should have stuck to your gut. Okay, one more. Which term refers to a medical procedure that fixes or sets a dislocation or fracture of a bone?
Reduction. No, I don't know, guys.
Which term refers to the medical procedure that fixes and sets a dislocation or a fracture or a bone? Remodeling, electric stimulus, reduction, pulsating electromagnetic therapy.
I would say C. What do you think, guys?
reduction? I don't,
C.
I was gonna guess A. None of them really sound right. It's A? Oh no. Reduction.
Hmm.
Just take a picture if
I
we
think I heard it in the
stuff
show
is
The
not.
Pit. So
Good pick. Which term refers to any of the openings between the fused vertebrae of the sacrum, transmitting sacral nerves?
Openings are foramen or
Could be
opening.
foramen, cornea, crest, or hiatus.
I'm gonna go with foramen because I know
either
that they're little
A or
holes.
yeah, there we go.
Because it's an opening, right? So
Yeah.
it's where the nerve's going to come out. All the nerves are going to come out of the foramen. Okay, cool. The bony ring located at the front of the talus. Again, this is all anatomy of the spine of the vertebrae themselves. Okay, the bony ring located at the front of the talus is called anterior arc, and you can also open your AMTA app if you want to figure that out. The vertebral foramen, anterior tubercle, or longitudinal arc. The bony ring located at the front of the talus is called, so talus like your C1. At this point, just guess it because we didn't do specific anatomy of it yet.
Well, I think it's an arch because the other ones don't make sense.
Anterior or longitudinal?
The front anterior, I guess.
Front, anterior, smart. Okay.
All right, guys, I gotta log off. I'll see
Okay,
you.
so we'll see you Monday. Monday.
Good luck with the test.
Thank
Thanks,
you.
bye. Just go have a good weekend.
You too. Bye-bye.
This type of bone is made of small structural beams called tuberculae or that gives the bone lighter weight. Yellow bone, spongy bone, compact bone, or resorptive bone. I'm not very familiar with this question, so I think it's maybe the first time I come across it, but it's okay. We learn something new every day. So it's a small bone made of small structure beams.
It gives the bone lighter weight. I don't know. Spongy? I don't know.
See? Not spongy.
Sometimes there's hints. You can find the closest hint. Good job. Were you good in school when you were younger, Robin? Awesome. Hinge, saddle, and ball and socket are all articulations or junctions between two bones and are called capsule, disc, joint, or membrances.
Joints.
Saddle.
Joints.
This is easy. Good job. What is the name given to the shoulder blade?
Scapula.
Like these are nice questions, huh? Some questions are ridiculous. Okay. What is the name of the hollow of the anterior aspect of the distal humerus, just superior to the trochlea? So we're talking about humerus. So where is that?
Your arm.
The arms, right? The upper arm. So we're talking about the anterior aspect, front aspect of that muscle.
And distals here.
Just yeah, the trochlea. We just found out it's kind of it's a bony landmark inside kind of that elbow. So best way is to kind of go through the app or wing it and see if you can figure it out. So it's a hollow anterior aspect. Okay, let's see if we can eliminate one or two, okay?
Okay.
So it's talking, okay, a coracoid process, where we can find the coracoid process.
A hollow is like a
Yeah, it's like a like kind of like this.
poop out, right? Yeah.
Yeah.
So it wouldn't be a tubercle. Process is, I feel like
Process something that's sticking out, epicondyle sticking out, and tubercle sticking out.
right. So the coronoid fossa. Okay.
Correct. Good job. Which term refers to the anterior inferior part of the pelvic bone? So anterior, front, inferior, little lower part of the pelvic bone. Anterior, inferior, iliac spine, acetabulum, iliac fossa, or pubis.
The pubis? The inferior part of the
Well, yeah,
I
it's the
can see where you
D.
can, which
D.
anterior, inferior part of the pelvic bone.
D.
D. Correct, Amanda. What are the 7 vertebrae of the neck called?
cervical.
The seven cervical, exactly. C.
Correct. See, that's a good, if you just ask questions like that, we all pass the test. Which term best describes the curves, ridges at the top of the pelvis?
The iliac crest.
Yes. I'm gonna give you hands up, ladies and gents. You're doing so good. Okay, I'm gonna stop the recording for this so we can share it. And go ahead and set up your